instrumental in setting up the endoscopy suite at the Sri Sathya Sai Institute of Higher Medical Sciences. So without further ado, please help me introduce Mr. John Whelan.
Good morning, everyone. I have no disclosures, but I need a microphone. There we are. So 9 years ago, I was a clinical manager in a very fast-paced endoscopy department at a major academic medical center. It was that professional experience and skill that provided valid foundation for my involvement with setting up what would be the GI endoscopy unit at the super specialty hospital in Puttaparthi. I recall that in the preliminary conversations with my physician colleague Hari, he stressed that my experience and credentials counted, but what kind of person I was mattered as much. That struck me as very different from any work expectation I'd ever known before. It is more common for people to care most about what you'd accomplished or what you could produce than who you were as a human being. Well, this foretold what would be not just a professional work experience, but a very unique and powerful life experience. My initial reaction to being asked was feeling genuinely humbled that I could have something to offer people halfway around the world. Who was I? What did I bring to the table? From my inexperienced perspective, I didn't realize the community that already existed. It was that community that would launch this endoscopy unit, not just any one person. I also didn't realize that what was needed was the basic tenets of healthcare, as much as my skill and experience. Still to this day, I feel so very fortunate to have helped with the beginning for this endoscopy unit. What affected me most, though, if this were a TV program and you were scrolling through to see whether you wanted to watch the show or not, it would be titled something like Very Internationally Experienced Midwest Boy Gets a Bigger Perspective. As much as I was an adult, I'd never traveled out of North America before. I remember on the flight to India, I was like a kid looking at the TV monitor on the seat in the back in front of me. I was realizing I was flying over places I'd learned about in grade school or just saw about in the news. So it was with some of this childlike wonder that I stepped into the cool, fragrant air in the middle of the night at the Bangalore airport. I stepped out into the first fresh air that I'd had since walking into the airport in Michigan, which was only a day earlier, but it was a whole world away. My senses opened up to a new world of sights, smells, sounds, and colors. The 2.5-hour drive to Puttaparthi was honestly very surreal. For one, because I'd only slept about 3 of the 17 hours of the flight. Brightly colored lorries, Brahman cattle on trucks, decorative flowers, tea stands. As much as I was dog tired, I was intentionally fighting off sleep so I could take this all in. We started right in that next morning. The first week would be physical setup and training of the nurses. We'd start procedures in the second week. The nurses were so appreciative and dedicated. Their devotion was obvious. It was really impressive how far people traveled to be treated at this hospital. This was so much different than the mostly elective, sometimes arbitrary, and very much taken for granted healthcare I was used to in the United States. I was so impressed with the providing of free services for so many people. And people genuinely appreciated and needed even the most basic services provided, what we take for granted. I also learned of the native volunteers who also traveled often very far to dedicate their time and provide supportive work. They were so sincere and fervent in their approach to what many of us would consider in the United States as very mundane tasks. The experience with healthcare colleagues struck me as well. I remember the very calm and unimposing manner and personalities of the physicians involved. Remember, I come from a U.S. academic medical center where titles and initials after your name mean everything. But in Puttaparthi, we were all there for a shared purpose and a common cause, service to others. There were no personal agendas. It became obvious very quickly that I was part of something much bigger than any one person. I met people from many other countries who were there to donate their time and expertise on behalf of the common good. The generosity of spirit and sincerity was remarkable. I was surrounded by kindness of character. So I came back to my hospital and my role feeling like I accomplished something so much bigger and better than anything I'd ever done before, feeling like it mattered so much more in the great scheme of things. What I ended up with was a life lesson in basic human values. It didn't matter that I couldn't speak the local language or that I looked physically different than the patients or most of the staff. What matters is what matters most in the service of healthcare. I've been a nurse for 34 years now. I believe the basic human values instilled by my parents and my faith led me to a career in healthcare. From early on, I was taught to help those in need and that everyone deserves respect. The best of what we can offer is service to others. To be truly effective as a caregiver, one needs to be both in the moment with others and truly in service to others. One also needs to role model through their actions. It's not enough to give lip service to concepts of charity or service. Providing ideal health care is about the other, not the self. It's about helping others and expecting absolutely nothing in return. It's about humility. One can have all sorts of initials behind their name, but that's not what the customer needs. For years as a manager, I would tell staff, new staff and veteran staff, that people came to our academic medical center expecting that we had all the knowledge, all the skill, all the latest toys. But what makes or breaks their experience is how you treat them as a person. Did you make eye contact? Did you address their concerns in comfort? Were they truly heard? Were you truly in the moment with them? I was so lucky to have this experience and get a bigger perspective on what service to others means. The bottom line, though, this wasn't about me or any one person. It was about all the people this can and does help. I learned so much about sincerity and service from everyone involved. It was Dr. Hari. It was the driver, Raju. It was the nurses, Prima and Kanya. It was the physicians from all corners of the world. It was the Indian volunteers who cut the sheets of gauze and prepped the supplies that we would use. It was the Dobies who washed the clothes. What's being accomplished in Puttaparthi at the Super Specialty Hospital and through the PSI organization is healthcare delivery that very practically and genuinely exemplifies the message on the archway of the hospital entrance. Service to man is service to God. Ideal healthcare delivery requires an open mind, open to others' beliefs, lifestyles, and concerns. Especially in light of recent world politics, we need to be reminded that it's important to pay attention to more than your corner of the world. There was and is a great need for the education, experience, and physical resources we so often take for granted. We need to genuinely care about what happens elsewhere. We're all responsible for humanity. Humanity is not the individual, it is all of us together. Public health, global health. These are more than subject titles or focus for an advanced degree. It's the essence and awareness of how we can and should help others. Thank you very much.